So next we'll go back to our case study. Before the family arrived, before Marie-Claire arrived, she had a health undertaking recorded on the Immigration Health Assessment portal, which we will come to in a minute. Her oldest 3 children had negative serology recorded in HAP, and there were no results recorded for the youngest 3. All the children in the family, except for Marie-Claire, had a measles, mumps, rubella and yellow fever vaccine prior to departure. Marie-Claire was not vaccinated. She was given a waiver from the live vaccines due to her HIV status, and she doesn't recall ever receiving any other vaccines. So next we're going to hear from Jacqueline Kennedy from Public Health, and we'd like, Jacqueline, if you could share with us the process if a patient arrives with a health undertaking and what action should be taken on arrival, and what do you want GPs to do in that process. So Jackie's a public health nurse in the HIV Public Health team at the Communicable Diseases branch at Queensland Health. She's been involved in HIV public health nursing since 1990 and has met many people from diverse backgrounds, including refugee background. Jackie works within a dynamic team that's passionate to support individuals, their families, friends and care providers, helping them live long, full, happy lives. Thank you, Jackie.
Thank you, Rachel. I'm pretty short. Can everyone see me? Okay. So, as Rachel said, I'm a public health nurse. I work in the HIV Public Health team, which is a part of the health department. We're a very small team. There's just about 5 of us in the team. And we have extreme confidentiality. We work inside of a health department building, inside of a swipe card entry room that's restricted to only our team. So we manage the notifications of HIV for all of Queensland. HIV is what's called a notifiable condition, which means that if a person has a test and it's positive, then that positive screening test is sent to the HIV reference laboratory. And if the results of that test is positive, then the HIV reference laboratory is required under the Public Health Act to send that result to us. When we get that result, we would then confidentially contact the doctor who ordered that test, and we would talk to the testing doctor to help prepare that person to give the result, basically, because most people who have a test in Australia are testing at a GP who's never had positive tests before. We then provide advice and assistance to those clinicians, and usually it's about helping them to give the initial result to the patient and then help them find somewhere to look after them. And then we have another special role of helping with contact tracing and people who may have placed other people at risk. So, remembering that those are the jobs that we do in the HIV Public Health team, we also receive a direct notification from the Immigration Health Services, it's BUPA at the moment, or sometimes directly from the Immigration Global Health, and this is what's on the referral that we get from them. So we get a HAP ID, and that's like a UR number for the person. We'll have their name, we'll have their date of birth and their gender. We'll have an information about the language that the person speaks and whether or not they may require an interpreter. I think was already mentioned that you can ask for an interpreter, and we always do. If we're speaking to a person who needs an interpreter, we contact the interpreter service. We explain to them that we want to speak and have a confidential discussion with a person about HIV, that we're going to give the person a false name and we ask the interpreter, can they please be from someone from out of the state? So we get someone who's not in the community. So we have an out-of-state telephone interpreter. We ask them to not ask personal questions about where you're from, or, and can they just please have a conversation with us about this initial conversation about the HIV. So we have contact details for the client, and sometimes those contact details are actually care of the community support worker that they're going to be attached with. So the HIV Public Health team can access the person's medical records in the, it's called the Qld program, which is the confidential immigration medical section there. So we can see the visa medical, we can see the x-rays that they may have had, and we can see from the Qld medical list there how urgently they may need to see a doctor when they get here. And often that's based around what medication they're on and what supply they're likely to have turned up with. For you to know, to get HIV medication, you need to have a specialist prescriber. So often that's about us assisting the person to have a referral quickly to enable the continuation of the supply of medications. Julian might talk about it later on, but certainly it's not unusual for people to arrive in Australia on medications which we would not normally continue to be prescribing. They're medications which are a bit old-fashioned, and they work perfectly well, but they might have side effects which now we know how to avoid. And so we may continue that initial medication, but they also would have a review to consider whether or not that's the simplest, best medication for them. We would also attempt to guess that, that the person may have contacts that are of special interest to us. And the story of Marie-Claire is that she's had all these children. She's had older children who have had testing, younger children that haven't had testing, but presumably the younger children were all born whilst she was on treatment, so we'd be very hopeful that they had not become HIV positive. That's what we'd expect, and that she's continuing on with the treatment in this pregnancy. We also facilitate an appointment, so that's helping the person to make contact with a specialist service, and then we actually enter into the immigration record that the person has followed through with attending an appointment with a specialist service. I think the question was, what advice, what can the GPs do? Well, it's to help the person to move through that process. So sometimes we'll be contacting the person or contacting the community support worker to help them to get a referral for a specialist service. Julian, Dr. Langton-Lockton works in a clinic which is especially accommodating of urgent appointments. So sometimes we'll be bypassing that GP referral process because the person needs to be seen more quickly than that, and that clinic is often very helpful in quick appointments. But the person often needs to be retested because of the stories the girls have just told us. They mightn't be comfortable that their previous result was accurate, so they might need to have another test to know for sure that their diagnosis is accurate. We link them to care. They like the care, they stay in the care, they get the treatment managed well, and then they live a long, healthy, happy life. This last one, I just put it in because it is actually the ASHM website. I hope everyone knows it. That's the Australasian Society for HIV Medicine. It's called ASHM. If you link into that, there's advice, and this is one of their decision-making in HIV steps, and it will just, this is slide 2 or 3, I think, of it, and it will just walk you through if a person turns up at your door who needs some assistance around HIV, there are a number of sort of continuums of care that you could follow there. Everybody, whether they're refugees or otherwise, you know, wants to feel at home when they're at home. They want to feel respected and accepted within the community. They want to have fun. They want to have friends. They want to be able to have, you know, intimate relationships. And certainly everything that we do in our role is to help a person to manage their HIV, so it's just another little thing they're managing, so then they can just get on with the rest of their life. Okay, thanks very much.